Our topic for today's presentation is Parkinson disease. I'm Ramandeep and my other group members are Vishal, SNEHA, Rahul, Kuljinder, Miranda and CYNTHIA. Objectives of presentation includes discuss Parkinson disease, pathophysiology, diagnostic measures, treatment and nursing management.
Definition: Parkinson's disease is a chronic progressive degenerative neurological disease which predominantly affects the older population. It is characterized by a constellation of clinical manifestations which include slowness of movement, rigidity, tremor, and postural instability or the lack of balance and coordination. It is a movement disorder, and as the disease progresses, body movements such as walking and talking are affected. Incidence: Parkinson's disease affects 1 in every 500 people in Canada. Approximately 6,600 new cases of Parkinson's disease are diagnosed every year here in Canada. Most of the diagnosed are over the age of 60. However, at least 10% of them develop symptoms before the age of 50. Approximately 4 million people worldwide are living with this condition. The etiological factors for Parkinson's disease are the following. Most cases are idiopathic or are from unknown cause. Other causes are viral inflammation, brain trauma, stroke, genetic predisposition, environmental toxins, or can also be iatrogenic or drug-induced, which is often a complication of antipsychotic therapy.
Hello everyone, my name is SNEHA and I'll be explaining about the signs and symptoms as well as clinical diagnostic measures used to diagnose Parkinson's disease. So we all know that there are mainly motor and non-motor symptoms which will be seen in Parkinson's disease. So the classical motor symptoms, which include bradykinesia, which means that is the slowness in movement, which is a clinical chief manifestation, as well as muscular rigidity, rest tremors. In rest tremors we can see that when a person is resting, either will be like sitting or sleeping, we can see that there are movements like the finger movements, their leg movements and many other things, as well as postural and gait impairment. And in non-motor symptoms we can see that there are olfactory dysfunction and there will be cognitive impairment, which is like difficulty in paying attention, difficulty in word finding. We can see they will be like stammering, difficulty in remembering things as well as learning information, as well as there will be psychiatric symptoms which includes depression, anxiety. Sometimes most of the people, like, they can hallucinate, they will be having delusion, and also impulsive and compulsive behaviors. Also, the signs and symptoms include sleep disorders, autonomic dysfunction, which includes orthostatic hypotension, constipation, bladder disturbances, and as well as sexual dysfunction. Also, most of the people with Parkinson's disease will have pain and can experience fatigue. So mostly the non-motor features are present frequently before the onset of motor symptoms, and this premotor or prodromal phase of disease can be characterized by impaired olfaction, which already said that there will be olfactory dysfunction, and constipation, depression, excessive daytime sleepiness, as well as rapid eye movement. In fact, the mood disorders and constipation have both been shown to nearly double an individual's risk of subsequently developing Parkinson's disease. Moving to the diagnostic measures. So the clinical diagnosis of Parkinson's disease is based on the presence of Parkinsonian motor features, which we already seen, that is bradykinesia with rigidity and resting tremors. So postural instability is typically a feature of more advanced disease. With that, in diagnostic measures, there'll be medical history and as well as physical examination. And in medical history, which includes current as well as past medication history, because there are some of the drugs which will be inducing Parkinsonian features. Some of the drugs like metoclopramide and domperidone. So these are the medication which induces Parkinson's symptoms, as well as past physical examination. In that we can see like head to toe examination. We can see there will be muscular rigidity, tremors and stammering when they speak, and so many other things, as well as neurological examination too, in which they can find bradykinesia and like the physical features like muscular rigidity and so many other things. And also there will be like testing agility to check the muscle tone. Neurological examination is used. And that's all about symptoms and diagnostic measures of Parkinson's disease.
Now let us talk about the pathophysiology of Parkinson's disease. Most of the cases have been linked to unknown causes, which we call idiopathic. However, other factors are also being considered, such as genetics, as researchers have identified specific genetic mutations that can cause Parkinson's disease. Another is environmental, such as exposure to certain toxins or other environmental factors. Age, as higher occurrence of Parkinson's disease is seen in those people aged 60 years and above, possibly related to dopamine neuron degeneration as a person ages. In Parkinson's disease, there is an unexplained loss of dopaminergic neurons in the substantia nigra of the brain. Because of this, there is decreased dopamine production. This further results to decreased activation of direct basal ganglia. The direct basal ganglia pathway is responsible for the facilitation of voluntary movement. Therefore, there is decreased excitatory response, which leads to bradykinesia or hypokinesia. These are the trademark manifestations of Parkinson's disease. Bradykinesia is the slowed movement, and hypokinesia is the absence of movement. Patients with Parkinson's disease exhibit decreased finger or heel-toe tapping. This means that they have slowed response when they are tested. Also, mask-like face, or they seem to have no expression. Shuffling gait means that they seem to have small steps while walking. Or they can freeze, meaning they will stop while they are walking. Also, resting pill rolling tremor also are seen in patients with Parkinson's disease. This tremor is relieved by intentional movement. Another effect of decreased dopamine production is the decreased inhibition of indirect ganglia pathway. This indirect pathway prevents unnecessary movement. Therefore, there is decreased inhibitory response. This is manifested by cogwheel rigidity, or the muscular rigidity of the limbs, led pipe rigidity, or the smooth and consistent resistance to passive movement of the limbs, as well as the postural instability, which gives the patients with Parkinson's disease a high risk for falls. Also significant in Parkinson's disease is the presence of Lewy bodies. These are alpha-synuclein protein deposits. These Lewy bodies build up in the brain, causing damage, therefore causing dementia and cognitive impairment. In a healthy individual, there is feedback circuit that causes paralysis when we are asleep. However, in patients with Parkinson's disease, there is an alteration in these feedback circuits in the brain. Therefore, these patients are experiencing sleep disturbance, anxiety, and depression.
Good morning, Professor. Good morning, guys. So I will be dealing with the nursing management for Parkinson's disease. So I have formulated 3 nursing diagnoses so that majority of the nursing interventions in relation to the Parkinson's disease will be coming under those three nursing diagnoses. So the first one is impaired physical mobility related to limitation in independent movement of the extremities related to rigidity, tremors, as evidenced by balancing and coordination deficits. Nursing interventions are: instruct the patient to get out of the chair by moving to the edge of the seat, placing both hands on the arm supports, bending forward, then to a standing position. Rationale behind this, the Parkinson's disease may have rigidity and tremors, so these precautions will help to prevent the fall. Second one is teach the patient to turn in a wide arc. Rationale behind this, to prevent the crossing of one leg over the other, this could cause a fall. Third one is to teach the patient to sit in a chair with the backs and arms rest. Use the elevated toilet seats or sidebars in the bathroom. Rationale behind this helps with the rising from a sitting position and prevention of falls. Is risk for injury related to disease condition as evidenced by difficulty in initiating movements, tremors, and rigidity. Nursing interventions are: the first one is remind the patient to maintain an upright posture and look up while walking. Rationale behind this, stooped posture may cause the patient to concentrate on walking erect and use a wide-based gait. Rationale behind this, balancing may be adversely affected because of the rigidity of the extremities. The third one is ineffective coping related to progressive chronic disease as evidenced by social withdrawal. Nursing interventions are: the first one is provide uninterrupted time to be spent with patient and encourage him to express the feelings and concern. Rationale behind this allows the patient to express extreme and powerful emotional feelings. Second one is assist patient only when necessary. Rationale behind this, dependency on the nurse decreases the self-esteem of the patient. The third one is offer positive feedback for the independent behavior. Rationale behind this, encouraging desired behavior promotes effective coping.
For evaluation criteria, patient will maintain functional mobility as long as possible within limitation of disease process as evidenced by the ability to control balance and coordination. Also, patient will remain safe from environmental hazards resulting from cognitive impairment. Family will be able to identify and eliminate hazards from patient's environment. Also, patient will use acceptable strategies to cope with problem and will have improved sense of self-worth. And lastly, patient will exhibit improvement in emotional well-being.